Hi, can you hear me?
Yes, hi.
Yes, hi Priyamvada. So good to see you. So, how many years is
Yeah.
it going to be since you've been battling lupus?
1.5. Like, it's not
Fantastic.
that long. Yeah.
Okay. Oh, great. So
I'm still
you
new in this game. Yes.
awesome, awesome. And just to our viewers, you are a patient and you're going to be a doctor.
Yes.
How
Yes.
stunning is that? How stunning is
Yes.
that?
It wasn't planned though.
So okay, we'll get to that. And the reason I thought this podcast would be so interesting is because a lot of lupus affects women from in the age of 13ish, and that phase, that is
Mm-hmm.
basically your school days where you're still deciding your career and things like that. So I remember when
Mm-hmm.
I was diagnosed with
Mm-hmm.
lupus at the age of 13, I was practically spending my entire day with an army of doctors. A few of them
Mm-hmm.
from the ophthalmology, some from the nephro, some from the cardio, and
Mm-hmm.
sometimes neuro. So it was like I'm with a battalion of doctors, and somewhere deep inside I felt like I want to be a doctor.
Yeah.
And I'm
Mm-hmm.
not telling you, it's not just me. I have seen so many patients through the Lupus Trust India activities, who are at the age of 13, who are 17, who are 16, who are
Mm-hmm.
like I've seen children who don't even at the age of 10 who don't even know what a cardiologist, and they
Oh,
say I want to be a cardiologist. So that's the
yeah.
impact being diagnosed with lupus at a young age has. So I think this will also
Mm-hmm.
you know be helping them in
Reach.
terms of that. Will
Yeah.
give them some kind of confidence that it is possible. And
Mm-hmm.
to our viewers, in this podcast we'll be having caregivers, we'll be having patients, we'll be having patients not
Mm-hmm.
only from the lupus, it could be from other chronic
Other.
diseases, rheumatic
Mm-hmm.
conditions too. We could also be having spouses of patients, so it's going to
Mm-hmm.
be a lovely audience
Very
who's going
wide
to hear us out.
audience.
Wide
Yeah.
audience, yeah.
Mm-hmm.
So can we get started with our first segment?
Yes.
Yeah, so I'm
Yes.
going to ask you to
Yes.
quickly, just tell me how were you even diagnosed? How was that journey of diagnosis? Just a quick, you know.
Yeah. So I was lucky enough to be diagnosed at a very early stage, again, because of the doctors who thought and caught on and like went in. But still, it was a big, like a journey to like come from, because this isn't common, right? Or even if it's common, people are not aware of this, or they would be like, what would be the possibility of someone having symptoms like a normal fever and joint pain and yet be diagnosed with something that is different? I wouldn't say big as such, but that is different. So it was a process, a huge process. So it took around 2 months for us to arrive to my diagnosis from when I was chronically ill. But like if I retrospect and look back, like small symptoms which seem like a small thing like hair fall or say joint swellings that we would attribute to maybe a muscle sore or hair fall due to stress, all that we missed. And like later, like 6 months later, it just shot up, and that's where we're like, okay, wait, let's start thinking in the same line. So it was a process. Like I wouldn't want to go into the technicality of it, but it took around 2 months. And but I'm very lucky I did get diagnosed in a very early stage where I wasn't like at my worst. So yeah, that was my journey.
Excellent. I think that's something we can relate because my father was able to predict a few symptoms and was saying, hey, this sounds like rheumatoid arthritis. So the early diagnosis has
Mm-hmm.
really done magic for both of us at
Mm-hmm.
least. Right. Now, can you
Yeah.
tell me in, again, a few minutes, how is it like when the doctor comes with the diagnosis and says, okay, now you are having systemic lupus erythematosus, I was 13, so I couldn't even pronounce it. It was didn't matter to
Uh-huh.
me. Okay, I don't care. I had to pop a pill. Didn't matter to me. It hit me only after a few years. Whereas in your
Mm-hmm.
case, how old were you when you got diagnosed?
I was 21. So
Right. So clearly you.
yeah. And for me, since I am pursuing my MBBS, so I had just completed my second year. And second year was when we were introduced this to this concept of autoimmune diseases. So I had freshly read about this, and then I never had thought that I would be able to, I would experience the other side, what like we usually read or concentrate more on the treatment or like what it was be, but I never knew that I would experience what I read. So when it came out, there was positive and a negative. Positive being like, I know a little bit more than the common man what is happening, but the negative being like, your mind just sticks to the worst possible outcome. Like, I know how this disease might progress and how quickly things might change and things like that. So it was a very mixed emotion.
And keeping in mind the fact that you knew what it was, you knew the details of it, right from the blood count to every bit, somewhere I think ignorance is bliss. Since I didn't know it, I was in quite a blissful state, at least for the first 2 years. So can you tell me how did you said for you it was a mixed emotion, and how did your family take it, like your mother, your father,
So firstly, again, not many people are aware of, there's this huge spectrum of autoimmune diseases. It's not only lupus. So not many people stand the concept, and not many people are aware of how things work out. Like, and my parents were new to it, so they didn't know what exactly this was. But they, like, when they got to know from the doctors who communicate what it was, and the added plus point was I could also explain to them in my own words what this was. Yes, there were a lot of thoughts for them, because this is like a point where it's our future is shaping or getting shaped, or we're heading towards something big in our life. It's like a lot of, again, mixed emotions. It took some days to process the whole thing. But one thing, they were like, from the beginning, they were very positive. They were like, no, this is not the end, or like, this is just a beginning of a new journey. And it's constant learning every day, like how to deal with it and how to be answerable to people who don't know about this and things like that.
So nice. I think that's how my family also took it. I think my dad was very practical about things. He said, okay, now the diagnosis is done. What next? With respect to what is his studies or what she wants to do, or how is she gonna, how can we give her the best life, keeping all these factors in mind. So it's great. So that's the beautiful role of family and how they digest it. Okay, so you're gonna be a doctor, right? And that's amazing. I'm having goosebumps. So proud of you, honestly. Tell me, so you told me already that it wasn't planned, right?
It wasn't.
Sure, right? Sure.
It really wasn't.
So it looks like there's some divine intervention out here. Lovely. Glad. So my next question would be, did it ever overwhelm you that you had lupus firstly? I know you just got diagnosed, and on top of it, you had to simultaneously handle such an intense course like MBBS. It's a exhaustive course, and you were just newly diagnosed, and
I was new to two things: MBBS itself and the diagnosis itself. So I knew that I was just at the beginning of climbing a mountain, and it was only going to get harder and harder as, like, professionally in terms of the course. It was going to be more challenging. And then it's like, this wasn't enough. You are like given a bag of like a huge weight along with which you have to walk. So it was very overwhelming. Like, there were so many restrictions, and like there was so many, more than anything, it's just like constant thinking, or rather overthinking, that goes on in your brain as to what next, if this happens, what this, and you're constantly coming up with plan A, plan B, plan C. But yeah, it just, on the positive side, I'm like happy that this happened, because I think this would be an advantage even in my profession. When I meet with patients, I would be able to connect with them as patients too, and I would like, now the drive to do this is even more like I just, it was a passion, but now I have like passion with a driven force towards achieving what I wanted to.
Yeah, I wrote it. I actually wrote it when I was, I came up with this. When doctors are also themselves patients, it's like you have the ultimate. I wouldn't say a weapon, but it's definitely what a power. You have the ability to empathize with them to such a fine extent, and at the same time you know what to do about it. It's I would definitely say it's like you said, somewhere you can somehow say it was a blessing in disguise. That's the only way you can tell yourself.